Well, the inside of you drives the outside. Aesthetic results that ignore hormone status are simply fighting biology. And again, those that look at aesthetic things without considering biology are also having an uphill battle. Hormone optimization without structural support can leave the face behind. Today, we're going to talk about both scaffolding and sculpting in combination. Hormone alignment with biology, regenerative aesthetics that are building both structure and performing well together for the long game. My name's Amber Bocknek, and you're watching an episode of Longevanity, our podcast where the inside world meets the outside, and we're so happy you're here. But before we begin, a very brief reminder that the educational content we cover here is not intended to diagnose, treat, prevent, or cure any disease. This is really meant to be an educational forum to talk about difficult subjects and bring forward educational pieces that you can talk about with your own provider, with the end goal of getting the best healthcare possible. So please view with that in mind. And before starting or undertaking any of these things, make sure you discuss it with someone who knows you and your medical history the best. So with that said, let's dive right on in. Now, I'm a girl who loves her analogies, and I'm sure you've heard me if you've watched me before go through different ones. But when I talk about this sort of relationship between the inside world and the outside world, we have to take a look at it all together. And my favorite analogy for this is to consider that of a house. So again, treating the outside without treating the inside is like painting a house with a cracked foundation. It may look good for the short term, but overall it doesn't hold up and the end results are not good. So, what we want to do is look at our body in the same way as a complex structure with inner workings as well as outer exterior expressions of some of the different health things we're facing and fighting every day. So, let's begin. So, hormones drive collagen production, and that is estrogen, testosterone, DHEA, all of that works together on how the skin holds up, how the tension in the skin is, how the fat pads stay plump, and how new collagen is formed. Without those signals, the body can't do the rebuilding that it needs to do. And these things work together, both the cosmetic treatments and some of the hormonal influences. So today we want to talk about both the scaffolding and the sculpting. So this is the hormonal work that again promotes better health from the inside and the aesthetic work on the outside. They're both designed to support each other. So again, where are you at? Have you been getting aesthetic treatments and the results, they don't quite sit the way that you were expecting? Well, you may not have been imagining it. The treatments themselves, they may be fabulous. But again, if you're working against biology, this is something we need to address. So we want to talk about this today and spend a little time on some of these different concepts. So first of all, I just want to spend a moment chatting about how hormones drive skin and facial structure. And they really do have a role. So estrogen, let's start with estrogen first because it's the one that seems to get the most attention anyway. So we might as well give its due. So estrogen stimulates something called a fibroblast, and fibroblasts are little cells in your body that make collagen. As the estrogen drops, your collagen production can drop as well. Testosterone. You betcha, ladies. We have testosterone too. Testosterone is not a man's hormone, it's a human's hormone. The ratios and balances are different between the genders, but we have both. So, testosterone in women structurally has a role. It helps to preserve our muscle tone in our face, in our neck, in our jaw. It also affects the skin quality, the thickness, and how dry or oily it is. Further, testosterone has a role, along with estrogen, in maintaining bone density. So again, testosterone is really an important part of it. Then there's this other hormone that you may or may not have heard very much about called DHEA. So DHEA is a precursor hormone. It has some direct functions of its own, but it's also involved in the making of estrogen and progesterone. It supports immune health, it supports skin hydration, and it may also give a bit of support to facial fat pads, which again can be lost over time with normal facial aging. DHEA may also have a role in supporting insulin production and helping to curtail a bit of insulin resistance. It does affect the skin. Again, insulin levels can and insulin resistance, and we can get glycation or connection of excess sugar molecules in the skin, which again will affect the collagen. So these are documented parts of our physiology. So from there, why are aesthetic procedures that don't consider hormones incomplete? Well, let me give you a couple of examples. The first example of them all is, let's just take a look at who is the most common. Doesn't mean they're the only person who comes in for cosmetic procedures, but where do we see cosmetics procedures at their peak? Most often it's a perimenopause or menopausal woman. So who is she? Well, you may be surprised to know that perimenopause, which is simply a change in hormone status before the actual stopping of periods, can happen a decade before those periods stop. So the average age in Canada, the median is around about 52. So if you go 10 years earlier, that can be in your 40s. Now that's for the median. Half of the population is actually even younger than that. So this could be a gal in her early 30s, early to mid 30s. So again, there can be hormone changes at any point, but most predominantly by somewhere in the 30s, things may be changing, and certainly well into your 40s, they're there. And then from that point forward, well, it's just a bit of a downhill slide and we see the hormones go down. So a woman at 47 in perimenopause already at this point statistically is making somewhere roughly between 30 to 50% less collagen than she did at 35 years of age. So again, filler placed into a face with active collagen loss looks different at 6 months than it did at 1 month. And sometimes that can be quite unfavorable. Biostimulators are something newer that we're seeing here in cosmetic procedures. They are substances that are placed to try to stimulate fibroblasts and other cells to produce more collagen. But their ability to do so is less in individuals who are already having suboptimal hormones. So again, if we're requiring nature to try to help build some of these things and it's missing some of the building blocks, it just doesn't go as well. It's not that it doesn't work, but again, it doesn't work as well as it could. So again, if you've ever had an experience where you had a great initial result, but it didn't last, or again, you were hoping for one thing and in the past it had, and now it's not doing what it did before, this could be part of your piece of the puzzle. So again, a composite scenario taken from a mixture of various people we see here in the office. A woman who was previously coming in twice a year for procedures and touch-ups may find at a certain point she's just not getting the same outcomes, longevity, or quality of work as far as what she experiences with longevity after the fact. So again, the hormone changes on the inside absolutely do have impact on the outside. Lastly, what about combination treatment? What happens with individuals when we look at the whole picture? We approach sort of the external appearance as an expression of internal health. Well, in these sorts of situations, what we're trying to do is optimize hormones and also aesthetic outcomes. When we give support to the hormonal system, it often has some spill-off benefits on overall metabolic health. And also we can help support the collagen production through, again, healthier diet, sometimes appropriate supplementation, and again, then with some of these other procedures to stimulate collagen itself. From there, again, we can use biostimulants, which are injected substances to try to help get the body to create new collagen. Sometimes we use exosomes or stem cell derived secretomes to try to stimulate the skin again to release these growth factors and develop healthier collagen. And in some situations, we can use lasers and energy devices to make little controlled wounds, with the end outcome of the controlled wound trying to stimulate the body to produce more of its own natural collagen. In all of these situations where we're trying to stimulate the natural process, we end up getting results that, first of all, look natural, which of course I think is what most of us are trying to do. But moreover, they tend to have a little bit better longevity for that person and they maintain themselves over time. So, this is where, again, it's more of a natural preventative approach that, again, tends to look more natural, which I think is what most people are looking for these days. And what we see then is a face that ages slowly, softly, naturally. And the goal is to keep that person always recognizable as themselves. So again, here at the office, this is something we really want to focus on, is trying to preserve you in your most natural restored form. It's you restored, you refreshed, not changed, not different. So again, if you've been someone out there who has been investing over the years in cosmetic or aesthetic treatments, and you were really quite happy for years, maybe, but more in recent times, you've noticed that things just aren't doing what they used to do or holding the way they used to, maybe it's time to take a look at what's going on in the inside and see if we can kind of get the inside and the outside working together for you. I'd love to continue with this. I'm going to have you edit that. I'd love to I'm going to try that again. I would love to continue this conversation. And if you're enjoying it, we'd like you to do a couple of things. First, if you notice here, we have a little QR code. I'd love to have you subscribe to our podcast. Please feel free to send us all your questions and comments. We love to really engage with our crew and make sure we have this interesting, helpful, and informative. And then from there, please consider subscribing to our inbox for our going to correct. And one other thing we offer is a inbox related subscription where we can send the podcast to you that you can view it in your time on your convenience when you've got a moment to spare. So hopefully that'll be something that works for you. Okay, I don't like that. I'm going to redo that. And if you want this conversation in your inbox every week, please subscribe to Longevanity. We'd be delighted to send you the recordings so that you can view it anytime at your convenience. Until then, I hope you've enjoyed today's episode. Again, please remember this is educational advice only, not medical. So if you have any questions about anything you see here, please do make sure you check with your care provider before engaging with any new or different form of treatment. Until next time, hope you have a wonderful day, and we look forward to seeing you on Longevanity. Okay, guys, sorry, there's a couple of cleanups in there. I'm trying to run the screen side by side. I'm not sure how much you can see my eyes clicking back and forth between the two, but I've got it up here on the screen while I'm trying to focus on the camera. So I'm just trying to get the hang of doing this so that I can follow the script a little bit. But thank you, and I hope that wasn't too painful to watch. I'm just going to end the stream, and then I'll do the teaser.